Welcome to the deep dive. If you've ever struggled with acne, you know the frustration, right? The breakouts, the redness, just that endless search for something that actually works.
Yeah, and navigating all the treatments out there can be, well, overwhelming. But what if shining a specific kind of light on your skin could actually make a real difference?
That's exactly what we're diving into today. We're exploring the science, the effectiveness of light therapy for acne, particularly focusing on red and blue light.
Hmm.
And this deep dive was prompted by sources sent in by you, our listener. You shared some incredibly valuable material with us.
Yes, we've got quite a stack here. There's a systematic review from PMC, insights from the American Academy of Dermatology, some general phototherapy info from the National Eczema Society, and a really comprehensive review from redlighttherapy.rehab. That one gave us an excellent foundation, actually.
It really did. So, our mission today is to unpack these specific sources, pull out the key bits of knowledge, and help you understand what's most important about using light therapy for acne based only on the material provided.
Okay, so let's start at the beginning. How does just, applying light to skin actually help with breakouts? What's the basic idea here?
It sounds almost too simple, doesn't it? Like just holding a flashlight to a pimple. But no, it's way more precise. It's about using very specific wavelengths, specific colors of visible light.
Right.
These penetrate the skin and trigger certain biological responses.
Exactly. And different wavelengths, they go to different depths, they have different effects. Our sources really zero in on two main players for acne, red light and blue light.
Okay, let's talk red light first. What's special about that wavelength?
So red light, it's typically using wavelength around, say, 600 to 650 nanometers. Some sources mention a broader range, maybe up to 1,000 millimeters, but the key thing is how deep it penetrates,
How deep are we talking about?
about 1 to 2 millimeters into the skin.
Okay, so it's getting just below that surface layer. And where does it go that helps with the acne itself?
It reaches these crucial areas, like the sebaceous glands, the inflammatory cells. Now, unlike some other treatments, its main job isn't really killing bacteria.
Oh, okay.
Red light's primary role, based on these sources, is reducing inflammation and speeding up healing. Think of it like calming things down at a cellular level.
Ah, so dialing back the redness, the swelling, the stuff that makes breakouts so visible and frankly uncomfortable.
Precisely. It worked by reducing inflammatory signals and the cells involved in that whole inflammatory cascade. It basically quiets down the skin's overreaction. Plus, it helps promote the skin's own repair processes.
Which is important for healing after a breakout, right? And maybe reducing scars.
Exactly. It does have a mild interaction with bacteria, but its real power for acne seems to be that anti-inflammatory healing effect.
Okay, got it. Red light. Calming, healing. So what about blue light? How does that one target acne differently?
Blue light uses shorter wavelengths, typically around 415 nanometers, sort of in that 400 to 500 millimeter range. And its mechanism, totally different. This is the light that directly targets the main acne bacteria.
Cutibacterium acnes. Used to be P. acnes.
Right, that one. Blue light has antimicrobial properties. What happens is it hits these compounds called porphyrins that the C. acnes bacteria naturally produce.
Uh-huh.
And that interaction creates reactive oxygen species, basically. It generates toxins right inside the bacteria and kills them. So by knocking down the bacteria count, you can help prevent new inflammatory spots from forming.
Ah, so blue light is the bacteria killer.
Pretty much, yeah.
So red light calms and heals. Blue light attacks the bacteria. I mean, it seems logical that using both might be the best bet.
And that's exactly what the sources suggest. This dual wavelength therapy combining red and blue light, it gives you that sort of 1-2 punch.
Right.
You get the anti-inflammatory and healing from the red and the bacteria killing from the blue. It's seen as a more comprehensive approach, often recommended to really maximize the benefits for acne.
Okay. And there was also a quick mention of infrared light in some of the reading.
Correct. Infrared operates at wavelengths we can't see, and it penetrates even deeper than red light. It's not usually used by itself as the main acne treatment.
Okay.
But it can kind of support overall skin health, improve circulation, maybe help with deeper tissue repair and scar reduction. It complements the work the red and blue light are doing closer to the surface.
Okay. That covers the science of how it's supposed to work. But the big question, right? Does it actually clear up pimples? What's the clinical evidence telling us?
Yeah, this is where that systematic review in PMC is super helpful. It combined data from 35 different studies, looking at nearly 1,200 patients using visible light for acne. And the findings, they're pretty compelling.
Okay, lay it on us. What were the big numbers?
Well, across all those studies, get this, 92% of patients saw at least partial clearance of their acne.
Wow, 92% seeing some improvement. That's a huge number. Was it just a little bit better or
Good question. The review found that on average, the total pimple count dropped by about 43% after roughly 4 weeks of regular treatments.
43% reduction in just a month? I mean, for people dealing with persistent acne, that kind of improvement could be genuinely life-changing. That's a serious number.
It really is.
Yeah.
And the review also pointed out that most of the studies involved either blue light or that blue plus red LED therapy. It really underscores that these wavelengths are where most of the research muscle is.
So if we break down that review a bit more, what did it find specifically for blue light, since that was the most common one studied?
Right, blue light was used in about 64% of the cases they looked at. And in those studies, 95% of the patients using blue light alone saw partial clearance.
95%.
Yeah, typically within 4 weeks. And by that 4-week mark, their total lesion count was almost cut in half compared to baseline.
That's really impressive for just blue light. Now, what about the combination blue plus red? Did the review show better results there, especially since we were just talking about it being more comprehensive?
Okay, yeah, this is where the data gets really interesting. So the combo therapy, that was used in about 24% of the cases. Now, the partial clearance rate was still very high, but this group had the highest percentage of patients achieving complete resolution.
Complete, like totally clear.
Well, complete resolution, as defined in the studies. For the combination group, that was 9% achieving it. Compare that to only about 2% overall, or with blue light alone.
Okay, wait. Only 9% got complete resolution. But that's still more than 4 times higher than with blue light by itself. That 9% figure, while it sounds small on its own, is actually a pretty big jump compared to single light therapy, according to these sources. That's a key takeaway if your goal is getting as clear as possible.
Exactly. It really suggests that synergistic effect is real, at least for, a subset of patients. And the combo therapy also showed faster improvement overall. Total lesion counts improved by 17% just at week 2.
Faster results, too.
Yeah, and by week 4, inflammatory lesions improved by 49%. Non-inflammatory by 24%.
So quicker initial results and maybe a better shot at getting fully clear with the combination. But we need to stress, right, these results aren't 100% clearance for everyone. It varies a lot person to person. It's not some guaranteed magic wand.
Absolutely. The sources are very clear on that. While it's promising, light therapy is often just one part of a bigger picture for managing acne. And you need patience.
Patience. How long are we talking to see these kinds of results usually?
Well, noticeable improvements often take, say, 2 to 4 weeks of consistent use.
Yeah.
But the full benefits, they often don't show up until several weeks, maybe even months later, sometimes even weeks after you finished a whole series of treatments. So, yeah, it requires commitment.
Speaking of commitment, how do people actually get these treatments? Is it only something you do in a clinic, or are there options for doing this at home?
Both exist, yeah. In-office treatments usually involve bigger, more powerful devices. That might mean shorter sessions or potentially stronger effects each time. But then you have home-use devices.
Which are less powerful.
Less powerful, yes. But they offer convenience for that regular, consistent use we just talked about. And the good news is the FDA has actually cleared some visible light LED devices specifically for home use for acne.
Okay, that definitely opens things up. So if someone's thinking about a home device, what are the absolute must-knows from the buyer's guides and the sources? Like the one in the redlighttherapy.rehab source.
Yes, that one had a great guide. First thing, check the wavelengths. You want red light in that 670 millimeter sweet spot for inflammation and healing, and blue light around 405, 420 millimeters for the bacteria. And like we said, dual wavelength devices are often a good bet.
Okay, wavelengths, check. What's the next really critical thing that's maybe easy to overlook?
Power output. And this is where people often look at the wrong number. You need to find the MWCMPO, that's milliwatts per centimeter squared, not just the wattage.
Oh, what about wattage?
Wattage just tells you how much power the device uses from the wall. It doesn't tell you how many light energy is actually hitting your skin at the right distance. That's the irradiance, the MWCMAP. Yeah. For acne, the guide suggests looking for devices putting out somewhere in the 40 to 100 millibismumator MPa per hour range.
That is such a crucial distinction. You could have a high wattage device that's just inefficient, right?
Yeah.
So MWCM more is the number that actually matters for the treatment effect.
Exactly. Then you want to think about the design. Do you want a mask for your whole face, a handheld one for spot treating, maybe a panel for larger areas like your back?
Right.
Safety is obviously huge. Look for FDA clearance or similar seals of approval from regulatory bodies, and double, triple check there's absolutely no UV light emission. A decent warranty, like at least a year, is also usually a good sign of quality and durability.
Excellent. Really practical advice there. So once you have a device, how do you actually use it effectively? How do you fit it into your routine?
Okay, consistency is absolutely key. Non-negotiable. You always want to start with clean, dry skin, no makeup, no lotions right before.
Got it.
Studies often recommend using the light therapy maybe 3 to 5 times per week. Now, the session length, that really varies depending on the device's power. You have
Mm.
to check the specific instructions for your device.
Right, because the AAD source mentions some studies use home devices for a really long time each session.
Yes, that's a really important point from the research. Some of those studies on home devices involved sessions lasting 30 minutes, even up to 60 minutes, sometimes twice a day for 4 or 5 weeks.
Wow, that's a serious time commitment.
It really is. It just highlights that home devices, because they are lower power, often require significantly more time and more frequent use compared to a clinical session to get results similar to what you see in the studies. Managing expectations on that is key.
Absolutely. Okay, can you use light therapy alongside other common acne treatments like the creams and stuff people might already be using?
Generally, yes. The sources suggest it can often be used safely in combination with things like topical retinoids, benzoyl peroxide, or even oral antibiotics sometimes. Dermatologists often do combine light therapy with other treatments in a plan.
Are there any specific treatments you should avoid mixing it with? Or any precautions there?
Well, one thing noted in the National Eczema Society source, which gives general phototherapy info, is relevant. They advise avoiding topical calcineurin inhibitors, things like Elidel or Protopic,
Okay.
on the same days you do light therapy. This is because they can potentially increase photosensitivity. It's a general phototherapy precaution, not just specific to acne light therapy, but definitely something to be aware of if you happen to use those creams for other reasons.
Good to know. Okay, so we've covered how it works, the evidence, how to choose and use a device. What's the actual experience like? What can someone realistically expect during a treatment, especially if they go to a clinic? And what about side effects or risks?
Right. So in a clinic, it usually starts with a consultation. They'll clean your skin. You'll wear protective eyewear. That's crucial. Sometimes they might apply a cooling gel.
Okay.
Then the light itself is applied. People usually describe it as painless, maybe just a mild tingling or a gentle warming sensation. The sessions themselves typically last somewhere between 20 and 45 minutes.
And right after the session, what's normal?
It's pretty common to have some mild redness or maybe a little bit of swelling, kind of like a very mild sunburn look, but that usually fades within a few hours. Gentle skincare afterwards, and definitely strict sun protection like use sunscreen are really important. But generally, you can get right back to your normal activities straight away.
Okay, that sounds manageable. What about less common side effects or potentially more serious risks?
Well, while the common side effects are usually mild and temporary, things like irritation, maybe some dryness or warmth, more powerful treatments, especially how you get in a clinic, do carry some potential risks. These could include things like lingering pain, burns, possibly blisters, or changes in skin color.
Changes in skin color.
Yeah, the AD source specifically mentions hyperpigmentation darkening of the skin, which can be more of a risk for people with darker skin tones. Also, patchy discoloration can happen if you have cosmetics or perfumes left on the skin during the treatment. Scarring is rare, but it is a possible risk.
This really hammers home the importance of seeing a professional, doesn't it?
Absolutely. Going to a board-certified dermatologist really minimizes these risks. They can assess your skin, choose the right parameters, and monitor you. The Eczema Society source also brings up some other general phototherapy precautions that are relevant,
Like what?
like increased sensitivity to sunlight overall, so you really need to be diligent with high SPF sunscreen, covering up, avoiding sunbeds.
Hmm.
Also, being mindful of certain foods that might increase photosensitivity before treatment. Things like large amounts of carrots, celery, figs, parsley, stuff like that.
Interesting about the food.
Yeah, and the possibility of nausea if you're using oral photosensitizers, which might happen with treatments like PDT for more severe acne. Also, light therapy can sometimes activate cold sores if you're prone to them, so using a lip balm with total sunblock is a good idea if you have that history.
Okay. And what about any long-term concerns, like skin aging or cancer risk? I know the eczema source mentioned that for UV phototherapy.
Right, that source does discuss accelerated skin aging, like more freckles or wrinkles, and a potential skin cancer risk that's related to the total cumulative dose. and the number of treatments someone receives over their lifetime, particularly with UV-based therapies like PUVA and UVB.
But the acne lights are visible light, not UV,
Right.
right?
The wavelengths used for acne are different. However, the general principle mentioned in that source about cumulative light exposure and the importance of tracking total dose, especially in a professional setting, it's still a relevant consideration. It just reinforces why clinic treatments monitor doses carefully and why professional oversight is important, particularly if you're thinking about long-term or very frequent therapy.
Okay, so putting it all together, light therapy isn't some magic bullet, not a one-and-done cure for acne. But the evidence definitely suggests it can be a very effective tool for managing it.
That's right. It's not necessarily a complete cure for everyone, but the studies clearly show it can significantly reduce the number of existing pimples and help prevent new ones from forming. And for some people, those benefits can last for months, maybe even years after they finish a treatment course.
So how do you keep those results going long-term?
Maintaining clearer skin usually needs a multi-pronged approach, according to the sources. Consistent, proper skin care is foundational gentle cleansers, non-comedogenic moisturizers, daily sunscreen, always.
Mm-hmm.
You might need to continue with some topical treatments as well. Lifestyle factors definitely play a role. Diet, staying hydrated, managing stress, avoiding things that irritate your skin, and just general good hygiene are also important. And the sources suggest that periodic follow-up light treatments might be beneficial for some people to kind of maintain those results.
It's also important we talk about the limitations, which the sources were pretty upfront about.
Yes, absolutely. The systematic review itself noted some research limitations, like some studies having small sample sizes or lacking comparisons to other types of combination therapies. Plus, sometimes the technical details reported, like dosage, power, distance from the light, were inconsistent, which makes comparing studies harder.
And we mentioned earlier, but it bears repeating, visible light treatments mostly target pimples.
Right. They're generally not considered effective on their own for things like blackheads, whiteheads, deep acne cysts, or nodules. Those different types of acne lesions often need different specific treatments. There's no single laser or a light therapy that can zap all forms of acne.
And while home devices offer that convenience factor,
They're less powerful than the machines in a clinic. That's a key trade-off.
right?
And that lower power usually means home treatment requires significantly more frequent sessions, and often much longer sessions, over weeks or months, to potentially see results comparable to clinical studies. It really demands a serious commitment to the routine.
And crucially, we need to differentiate professional phototherapy from just hopping in a commercial sunbed.
Oh, massively important. Clinic treatments are controlled, the wavelengths are precise, the dose is monitored by trained professionals. Sunbeds? They're unregulated, they blast you with damaging UV radiation, and they carry much, much higher risks, including a significant risk of skin cancer. Even home UVB machines lack that critical professional safety monitoring you get in a clinic.
So really, pulling all this together from these sources, light therapy requires a highly personalized plan.
Absolutely. The best approach really depends on your specific type of acne, how severe it is, your skin tone, your overall health. It needs to be part of a tailored plan, and honestly, talking to a board-certified dermatologist is vital. They can help figure out if light therapy is even right for you, and if so, how best to use it, maybe combining it with other things.
Okay, so let's recap this deep dive then. Based on the sources you provided us, light therapy, particularly using those red and blue wavelengths, clearly comes across as a promising, non-invasive option for helping manage acne.
Yeah, it works by hitting those core issues. Red light helps reduce the inflammation, and blue light targets the acne-causing bacteria.
And the clinical evidence we looked at, especially from that big review, it's compelling. It shows high rates of at least partial clearance and significant reductions in pimples for many people, particularly those with mild to moderate inflammatory acne.
And that combination of blue and red light seems to offer a particular edge, maybe a higher chance of getting near total clearance, according to those studies.
But, and this is a big but, it's essential to go into it with your eyes open. You need to understand the specific types of light, the potential benefits, yes, but also the limitations and the potential risks we discussed.
Right. Consistency in use, making sure you're using a device with the right technical specs. Remember that MWCMOR number, having patience, and definitely getting professional advice from a dermatologist. Those are all key ingredients for success if you're considering this path.
We are genuinely grateful for the sources that made this deep dive possible today, and especially that comprehensive review from redlighttherapy.rehab. It really helped lay out the whole landscape of light therapy for acne so clearly for us.
It really did. Gave us such a solid base to work from.
So Thinking ahead, given the evidence we've seen and the fact that some of these devices are becoming more accessible, how might light therapy actually change the way we approach daily skincare and acne management in the future?
And maybe more personally, if you, listening right now, are considering this, what are the really key questions you should be asking? Questions about your specific acne, your skin type, your goals, to figure out if light therapy is the right piece of your skincare puzzle.